Thinking about getting some injectables but don't know where to start? Welcome to my new series called Injectables 101. Hi, my name is Dr. Jenny Liu. I'm a board certified medical and cosmetic dermatologist. Welcome back to my YouTube channel. And today I'm tackling the most commonly performed injectable treatment in aesthetic dermatology, and that is Botox injection. So whether you're just curious, wanting to learn more, or is actually thinking about getting it for yourself, I'm going to break it down in today's video. So if that sounds good, don't forget to like, subscribe, and hit that notification button. So what is Botox? Botox essentially is a purified protein from a bacteria called Clostridium botulinum. You may be familiar with this food poisoning term called botulism. Essentially, it's caused by this bacteria where it can have scary muscle paralyzing effects from the food poisoning. Now, when medical doctors and researchers observe this, they're able to isolate this protein toxin, and we actually now use it in much smaller controlled doses for medical and aesthetic use. I know it sounds scary, but the doses that we use when it's in the right amount can have wonderful and amazing results. As far as the use in cosmetic dermatology or just for cosmetic uses, it was interesting because back in the 1970s, Botox was mostly injected for treatment of movement disorders, particularly like eye movement disorders. And then again, ophthalmologists at that time observed that when they injected Botox around the eyes, it helped with their wrinkles, like the wrinkles lessened and disappeared. And that is what led to 2002 FDA approval of the use of Botox for cosmetic use. Now, when we say Botox, we really mean neuromodulators. That is really the category that they fall into as far as what they do. And I'll explain that in a little bit. But Botox being really the original that's owned by Allergan, it's really become like the household name that we just think about and we throw it out there, even with the injections. But just understand that Botox itself is actually a brand, and there are quite a few other brands too. Just like, for example, we use tissue and Kleenex interchangeably, but there are a lot of other different tissue brands, but Kleenex is like the OG. It's a similar concept here. As far as the other type of neuromodulators that work similarly to Botox, there's Dysport, there's Xeomin, there's Druvo, there's Daxxify. They all work and basically paralyzing the muscle and helping with dynamic wrinkles, but they just may differ a little bit depending on the individual. How well it works for one may work a little bit differently for the other, the amount used, and then how long they last. Now in this video, I'm going to just simplify and say Botox, but understand that there are these little nuances, but essentially they all work very similarly. So how does Botox work? Botox, why they're called neuromodulators, is because they affect the release, or they block the release of acetylcholine at the neuromuscular junction, thereby causing your muscles to relax, become temporarily paralyzed. And explain that a little bit more. So whenever we want to make a certain facial expression, for example, frown, the signal from our brain tells our muscle, okay, you need to contract and make that motion. And that occurs because the signal releases acetylcholine, which then acts on the muscle. Acetylcholine causes the muscle to contract. Now, if you inject Botox into this area, even if you're telling yourself, I need to frown or I want to frown, you physically can't do that because the signal is blocked and your muscle is basically not able to move. It's a really funny sensation if you ever had it before. Now, regardless of the brand of Botox, they just work in slightly different ways, but they all essentially block the release of acetylcholine, which is why neuromodulators, and that is why they're called neuromodulators. Now, because of that, Botox really works to improve dynamic lines or dynamic wrinkles. What I mean by that is basically wrinkles that are etched into your skin over time from repeated muscle movements. So, smiling, crow's feet, raising up your eyebrows, the horizontal forehead lines, and then frowning, the 11s that we call it. Now, let's talk about some of the common uses of Botox. For cosmetic use, it is FDA approved for treatment of the glabellar, the frown, 11 lines, the horizontal wrinkles, as well as crow's feet. But we actually use it off-label in lots of different ways. For example, we can use it to kind of elevate or arch your eyebrow. You can use it, inject it into the nose for those that have horizontal lines. We call those bunny lines. You can inject it into the upper cutaneous lip for those who have what we call a gummy smile. Like when you smile, your upper gums show a lot. You can use Botox to actually lessen that. can do a lip flip. You can kind of use Botox to treat the perioral lines to help with like the smoker lines. You can use it for masseter muscles to kind of reduce hypertrophy and provide more of a heart-shaped face. You can use it to treat like chin dimpling. You can even inject Botox along the jawline and the neck to reduce like platysmal band, helping with the neck rejuvenation as well as define the jawline. Botox, super dilute and injected superficially, can help with facial flushing, especially for those that have rosacea. And with that treatment can also offer some temporary pore tightening benefits and may also help with oiliness. And Botox can also be injected into scars to help with hypertrophic scars. And then another use that I treat medically is for hyperhidrosis. And particularly, I find it to be very helpful for bilateral axillary hyperhidrosis, so underarm sweating. It seems to be very well tolerated. You can also do it for like sweating of the hands and feet, but those areas tend to be more sensitive and can be very painful. Now, other uses of Botox medically includes for chronic migraines, for muscle spasms of various locations. For example, like my husband, who is an ENT surgeon, they will inject Botox into the vocal cords for vocal cord spasm. Can even inject Botox into the parotid glands for hypersalivation. But in general, medical treatment, the doses are used in much higher amounts than what we would use for cosmetic purposes. Now, let's talk about what to expect during your treatment. Also, what to think about beforehand and some of the things you should be aware of post-treatment. First and foremost, it is really important to find an injector that is experienced, whom you're comfortable with. And definitely that injector should be giving you a consultation based on what really matters to you and what you're interested in having done. Also, during that consultation, you should talk about what your goals are. Do you want a completely frozen face? Are you really just in for maybe prevention? Or you want a partially treated face but still retain some movement? But with that, understand that the wrinkles are going to be somewhat present if you're able to move. So all of these things really matter. And this is why finding someone that is not only experienced but who you're comfortable with really is the most important thing. Now, as far as before the treatment, Botox is something that is very quick to do, very easily done. The only thing to be mindful of, aside from finding an injector that you're comfortable with who's experienced, is it does take some time for the Botox to kick in, anywhere between 1 to 2 weeks. And you also may end up with a little bit of bruising or irritation on the skin. So it's definitely not something you want to do the day before an important event, certainly. And if you want that Botox to kick in before the event, consider going in maybe 2 to 4 weeks ahead of time. So that way it is ensured that you're getting the benefits of the Botox before that important event. So what to expect during the actual treatment? Number one, your skin is cleaned and prepped with alcohol, and then your injector will mark all the areas you're going to have treated. And this is where it's so personalized. It totally depends on your goals, where you want to treat it, and that kind of dictates the volume or the amount and therefore the price. But this is why having a conversation during that consultation and finding someone that you're comfortable with who's experienced really matters. Then the injector will inject the Botox. The injection itself is actually really quick, anywhere between 5 to 15 minutes. It just all depends on the areas and the amount that is used. During the injection, it may feel a little uncomfortable, like a little bee sting, and immediately your skin may look a little bit welted up, almost like little mosquito bites, and sometimes you may get some bruising. But otherwise, it's really quick and it's very well tolerated. Most people do not require any sort of topical numbing. And also for those that have their forehead treated, you may have a little bit of a headache, but usually that is just very short. It does not last long and should resolve by the end of the day. Any redness and little swelling also should resolve by the end of the day. The bruising certainly can last a few days, but you can cover that with makeup. The one thing you definitely want to be aware of is you want to stay upright until the end of the day, or for at least 6 to 8 hours. What you don't want to do is basically get your Botox and go home and take a nap. Because Botox will diffuse about 1 centimeter, if you were to position yourself in a position like, say, sleep on your right or left side, that Botox will diffuse and travel to places that you don't want to, and therefore will affect the results. So the one thing you want to do is basically stay upright until the end of the day if you have Botox done in the morning or for at least 6 to 8 hours. And similarly, if you're thinking about going for a workout, you probably want to wait again for 6 to 8 hours just to minimize any sort of traveling of that Botox. But certainly, you don't need to modify your skincare routine at the end of the day. And if you have any bruising, totally okay to cover that with makeup. Now, the one thing to understand is that depending on the neuromodulator that was used, it can take anywhere between like a week to 2 weeks for it to fully kick in. And you really want to give it that full time period because the muscles don't all become relaxed or paralyzed at the same time. You may have a little bit of asymmetry, especially if you make certain expressions. And this is where if you're not patient, you may think that the treatment is not working or you look terrible. So this is where you really want to give that full dedicated time period before you decide whether it was an effective treatment or if you want to go back or have a little bit more tweaking done. Give that full time period for it to fully kick in, then you can reassess. Now, Botox typically lasts anywhere between 3 to 6 months. It just depends on the brand that is used, but also on you, how you uniquely metabolize the toxin, how expressive you are, and your goals. If you're really using Botox for prevention and you're not very expressive, you don't have deep etched in lines, you definitely don't need to get it as frequently compared to someone that have super strong dynamic wrinkles etched into their skin at baseline. And if they really want to get that effectively treated, then it does require more regular treatment with neuromodulators. So it all depends, but usually anywhere between 3 to 6 months. So just to give you guys an idea, because it's so hard to give personalized recommendations on camera, but in general for Botox units, and this is the original elegant Botox, it's slightly different depending on the other types that you use. Could be more, could be less, but in general for like the frown line, the glabella, depending on the person, it's anywhere between 15 to 25 units. For forehead, it's anywhere between 10 to 20 units. Crow's feet, anywhere between 10 to 14 units per side. Bunny lines, 2 to 4 units. Lip flip, 2 to 6 units. Chin, 4 to 6. So it just varies, but kind of give you an idea of how much is typically used to have an effective result. And also keep in mind the amount injected could also vary each time. In this sense, in theory, if you're really good about getting your injections and you have your muscle continuously paralyzed and relaxed, in theory, your subsequent amounts could be less because it's just not as active anymore. Lastly, let's talk about preventative Botox, because this is a question I get all the time, like when is the right time? And honestly, there isn't a right time. It's so personal. Also depends on when you're ready. But what I would say is if you're starting to notice those expression lines that you create with movement, with expression, starting to kind of be present superficially at rest when you're not making those facial expressions or emotions, this is where getting Botox regularly can prevent them from deepening. And truthfully, that is how I view preventative Botox. Now, there certainly isn't anything wrong if you are super young and don't have any wrinkles at rest, but you're super expressive and worried that wrinkles may form. I think getting baby doses of Botox in those locations can be helpful. But you want to be careful because if you get regular Botox, really heavy doses of it, it could potentially lead to muscle atrophy because you're not using those muscles. And that can certainly impact how your face ages, or it cause overactivity of other muscles that you're not treating and lead to less desired outcome. But overall, Botox can be very helpful for treating dynamic lines, and it's very quick to do, low risk, low downtime, and it's temporary. So at the end of the day, if you don't like it, once it wears off, you don't ever have to get it again. So I definitely recommend Botox for those who are entertaining and wanting to start aesthetic treatments and improving their facial aging, but maybe don't want to invest or not ready for the bigger stuff like fillers or ablative lasers. Botox can be a great place to start. All right, guys, I hope you found this detailed video helpful. Comment below if you had Botox, whether you like it or not, and other topics cosmetically that you want me to tackle next. Again, thank you so much for watching. I'll see you guys next time.